All right, today we're going to tackle a really common but, often misunderstood condition, oral thrush. We're going to break down exactly what it is, why it even happens, and of course, what you can do about it. So let me just ask you this straight up. Have you ever looked in the mirror, maybe while brushing your teeth, and noticed these kind of weird, creamy white spots on your tongue or cheeks that just don't brush off? If that sounds familiar, you're definitely in the right place to get some answers. Okay, so let's get into what we're actually talking about here. The official name is oral candidiasis, but pretty much everyone just calls it oral thrush. Now, here's the fascinating part. The fungus that causes it, Candida albicans, is already living in your mouth right now. Totally normal. The problem isn't that it's there, it's when it starts to grow out of control and throw the whole system out of balance. Which, of course, leads us to the big question, what is it that messes up that natural balance? Let's take a look at the key things that can give this usually harmless fungus a green light to, well, take over. So there are a few key things that can roll out the red carpet for this fungus. If your immune system is weakened, it just can't keep the fungus in check like it normally would. High blood sugar from diabetes, well, that's like an all-you-can-eat buffet for yeast. And antibiotics are a huge one. They can be a bit of a bomb, wiping out the good bacteria that keep Candida in line, leaving the coast clear for it to multiply. Then you've got things like poorly fitting dentures, dry mouth, and smoking. They all disrupt that delicate ecosystem in your mouth and bump up your risk. So whenever you hear the word infection, your brain probably goes right to, wait, can I give this to someone? Can I catch it? It's a totally normal and really important question to ask. And the answer is, well, it's a little bit of a yes and no. The Candida fungus itself can be passed through direct contact, like kissing. But oral thrush isn't considered super contagious. And here's the bottom line. A full-blown infection usually only pops up if the other person already has one of those risk factors we just talked about. Okay, so we know what causes it, but how do you actually know if you have it? Let's switch gears and talk about the telltale signs and symptoms that you should really be on the lookout for. The absolute classic sign is those white creamy patches. Some people say they look a bit like cottage cheese. But it's not just what you can see. You might also feel general redness or soreness, or notice that the corners of your mouth are cracked and red. Some people even describe this really strange, cottony feeling in their mouth, a loss of taste, or actual pain when they eat or swallow. It's so easy to see symptoms like these and immediately think the worst or just jump to conclusions. But, other things can cause similar problems. So how can you be sure about what you're actually dealing with? And this right here is the most critical piece of advice. Don't play the guessing game. If you've got any of those symptoms and they're just not going away, the single best thing you can do is go see a professional. A dentist or a doctor is the only one who can give you a real, definite diagnosis. Okay, so you've listened to that advice and you made the appointment. What happens now? Let's walk through how oral thrush actually gets diagnosed and, more importantly, how it's treated. The good news is, the process is usually super straightforward. It'll start with a simple visual look-see. Sometimes the doctor might take a tiny scraping from one of the white patches to look at under a microscope, just to be 100% sure it's the fungus. In rare cases, they might do a culture, but honestly, a lot of the time, just looking is enough to know. When it comes to treatment, there's a really smart two-pronged attack. First, you go after the infection directly with antifungal medications. That could be a mouth rinse, a lozenge, or maybe a pill. But, and this is just as important, you have to address what caused it in the first place. That might mean getting your blood sugar under control, tweaking a medication, or getting your dentures refitted. And here's some more good news for you. With proper treatment, you should feel better pretty quickly. Most cases of oral thrush will clear up completely in about 1 to 2 weeks. Another question that I know is on your mind. If it's just a mild case, do you really need to bother with a doctor, or can you just ride it out and hope for the best? Look, it's true that a very mild case might go away on its own, especially if the thing that caused it is gone. But the strong recommendation is to get it treated. Why? Because that ensures the infection doesn't get worse, become more painful, or even spread further down your throat. So we've covered the what, the why, and the how. Now for the final, and I'd argue most important part, how can you be proactive and stop oral thrush from ever showing up to begin with? A lot of this stuff is going to sound familiar, because it's all about simple, healthy habits. Great oral hygiene, we're talking brushing and flossing, is your #1 defense. If you have dentures, cleaning them like your life depends on it is a must. Cutting back on sugar, that starves the yeast of its favorite food.
And no surprise here, quitting smoking and getting regular dental checkups can make a world of difference.
This quote just nails it. The bottom line is, yeah, oral thrush can be annoying and uncomfortable, but it's absolutely not something to panic about. It's a common issue, and we have clear, effective ways to treat it. So if you remember just one thing from all of this, let it be this. Don't ignore the signs. Pay attention to what's going on in your mouth. If you even suspect something's up, just get it checked out. It's always the fastest and safest way to get back to feeling normal. And that just leaves us with one final thought. Now that you're armed with all this info, maybe it's a good time to think about your own oral health. When was your last checkup? Because prevention, as they say, is always the best medicine. Thanks for joining me.